The use of pharmaceuticals in the treatment of mental illness is significant but challenging. Anxiolytics, antidepressants, and antipsychotics are vital drugs that offer stability and aid in the management of symptoms for a lot of people. According to NHS data, the number of prescriptions for antidepressants in the UK rose from 50.9 million in 2015 to 74.2 million in 2019. Currently, antidepressant use among adults in the UK makes up half of the population, and youth use is at an all-time high. Despite their advantages, the rise in prescription rates highlights how crucial it is to use these drugs in conjunction with other therapies rather than as standalone treatments. Dependency presents a serious problem that shouldn't be disregarded. To ensure long-term, effective treatment, this research highlights the significance of adopting a balanced approach to mental health care, combining medication with therapy, lifestyle modifications, and support networks. While they offer significant risks, mental health drugs, which are necessary for treating a range of diseases, can offer significant relief. These therapies can improve daily functioning and overall well-being while also lessening the symptoms of mental health conditions, which can have a profound effect on people's life. However, because of the complexity of these drugs, using them calls for a well-rounded approach that considers both any potential benefits and associated risks. In the UK, calls for more stringent monitoring have arisen from worries about the long-term use of antidepressants and benzodiazepines. In 2020, a study was published in the British Medical Journal that showed a growth in the length of prescriptions over time, with some patients being prescribed considerably longer than necessary. Concerns about reliance, withdrawal, and potential decreased efficacy over time are brought up by this trend. On the other hand, prescription drug abuse in the United States has presented certain difficulties, especially with benzodiazepines, which are prescribed to treat anxiety and insomnia. Prescriptions for these medications increased from 8.1 million to 13.5 million between 1996 and 2013, a 67% increase, according to the American Psychiatric Association. The CDC discovered that the number of deaths from benzodiazepine overdoses rose from 1,135 in 1999 to 11,537 in 2017, highlighting the lethal consequences of addiction and misuse. These data from the US and the UK demonstrate how vital it is to use cautious prescribing practices, provide thorough patient education, and design all-encompassing treatment plans with ongoing monitoring and evaluation. Treatment for mental health illnesses must be approached holistically, incorporating counseling, lifestyle changes, and robust support systems to achieve sustainable recovery. Combining cognitive behavioral therapy, CBT, with medication therapy has proven to be quite effective in the United Kingdom. 49% of patients who combine CBT with medication report significant improvement in their symptoms, according to NHS data. This all-encompassing approach acknowledges that although medication can treat physiological imbalances, therapies like cognitive behavioral therapy, CBT, enhance mental resilience by giving patients coping mechanisms for dealing with and overcoming their illnesses. Making lifestyle adjustments and getting support from peers, family, and friends can help create the foundation for long-term rehabilitation. This mix of therapies encourages a more thorough, continuous healing process, guaranteeing that individuals are encouraged in multiple methods to re-establish and preserve their mental health rather than merely being reliant on medicine. To lessen dependency and enhance treatment, the NHS in the United Kingdom advises yearly reviews for patients with ongoing prescriptions for pharmaceuticals. Despite these recommendations, people are usually the ones to start these important check-ins because doctors don't always give scheduled reviews in advance and healthcare systems might become overwhelmed. This discrepancy highlights how important it is for patients to take the initiative to manage their healthcare. It is imperative that people on long-term drugs try to schedule medication reviews and follow-up visits. This proactive approach makes sure that any potential problems, such as reliance or unfavorable side effects, are quickly recognized and addressed, and that the course of treatment is tailored to the patient's current state of health and rate of recovery. Long-term medication management may be made far more successful and safer by actively collaborating with healthcare professionals and advocating for routine medication assessments. As such, it is a crucial aspect of long-term health. This means taking an active role in therapy, maintaining supportive relationships, and closely monitoring drug regimens. Instead of being passive participants, patients must advocate for routine updates and adjustments to their treatment plans as needed. Although patients usually take the lead in this process, healthcare professionals also have a significant role to play. The introduction of electronic health records, EHR, in the U.S. has created new avenues for communication between patients and providers, yet it is the responsibility of the patient to make use of these tools to remain informed and involved. In a similar vein, the NHS long-term plan in the UK places a strong emphasis on individualized care, although its efficacy depends on people communicating their needs and preferences. Although patients and healthcare professionals must collaborate closely, it is the patient's responsibility to take the effort to seek out comprehensive care and speak out for themselves. It is crucial to understand that using prescription drugs for an extended period can cause dependence, aggravate pre-existing mental health conditions, and even create new difficulties. As a component of a more comprehensive treatment plan, medications are a tool for treating symptoms rather than a cure. Understanding these dynamics and actively engaging in a multifaceted, well-rounded approach to care that prioritizes long-term well-being over the short-term usage of medicine is necessary for taking charge of one's mental health journey.